Hi, how are you? I'm sorry. Hold on, I think there's something wrong because I can't hear you.
What about now?
Oh, I can hear you now.
Uh, just a quick question. Do you want me to call you Gabriel or Gabby?
Gabby's fine. Mm-hmm.
Which one do you want? Hi, Steve.
Hey, how's it going?
How was your birthday? Hi, Jacob. Hi, Scarlett.
Hey, how are you?
Hi, Nicola. Can you see my screen? Okay. And you all hear me well? Okay. Okay. Because I bought a new microphone, I wanted to be sure that the voice is okay. So, this first session, I hope it is not too long. Actually, maybe a little bit shorter than the other sessions. We want to discuss some basic terminology and how to learn the basic terminology in medicine. Why we need the basic terminology in medicine? Because physicians use this terminology and actually they communicate with each other with these terms. And when you listen to them and you are not familiar with them, you think they are speaking another language. And you cannot push them to change it. They use it and it is common in medicine. And if you want to be in communication with them, you need to learn. Otherwise, it will be very difficult for you to communicate with them. The basis for this medical terminology is each term is about a specific condition or a specific thing. So when we use that term, we mean one specific thing, one specific procedure, one specific direction. And we don't make mistake with other terms. So that is why they use it, because they want to be accurate when they are transferring the information. The basis for medical terminology comes from Greek and Latin language. So at first, it may be a little bit difficult for you to learn them, but there are not too many words to learn. And actually, some of them are already used in common language, but the combination may be different. Most of the medical terms are a combination of a root and a prefix or suffix. It happens in many words that you use in your common language. They are usually a combination of a root, a noun, a verb, and a suffix or prefix. But the same thing happens here, but with some other word. The roots, as the name shows, are the building block of the medical terms. The main meaning of the medical terms comes from the root. For example, we don't say heart, we say heart. Gastro means stomach. Gastrointestinal means referring to stomach and intestine. Osteo means bone. So anything that uses the root osteo is referring to bone. Osteology, studying the bone. Osteotomy, cutting the bone. Osteoarthritis, inflammation in bone and joint. You never use the roots alone. They are often in a combination form with another root or a suffix or prefix. And the roots can be present anywhere in the word. So there is no rule for it to say, for example, the middle part is always the root. No, sometimes it is at the end, sometimes it is at the beginning. For example, arthrocentesis means aspiration of the joint. The arthro is the root at the beginning. Encephalic means inside the head, and cephal is the root, and it is at the end of the xeroderma. Derm means skin, xeroderma means dry skin, and derm is the root at the end. And myocarditis, we have two roots here. Myo means muscle, card means heart. Itis is a suffix, means inflammation. So myocarditis means inflammation of heart muscle. You have two roots and one suffix. So you see there's no root, you just need to learn it. Prefixes, like the prefixes in the English language, comes at the beginning of the word and change the meaning. But the medical prefixes are some specific prefixes that are used in the medicine, like anti, dis, hyper, sub, with each their specific meaning. The same thing for suffixes. But when we want to combine a root with another root or with a suffix, we usually add the letter O between them. For example, cardi means heart, logi means study. So when we want to combine them, we don't say cardiology, we say cardiology. We add an O between them. Or angi means vessel, edema means swelling or edema. We don't say angioedema, we say angioedema. So we add an O between them. This O is a connection letter. I have provided the list of roots, prefixes, and suffixes in musculoskeletal field in 3 tables. So you can see them here. I don't mean you to learn them, to memorize them. If you ask me, I may know them, but I haven't memorized them. I learned them by using them, okay? So don't try to memorize them, but just read them, be familiar with them. And gradually during this course, you will see I try to use the specific and the technical terms in medicine. So it may be at first a little bit difficult for you, but it makes you familiar with this language. So when you want to communicate with surgeons in future, you will be prepared. So again, you don't need to memorize them. I will not ask these words and these roots and suffixes as the question in the exam, but these are just here for you to become familiar with it. So in future, if I'm talking about an osteotomy in the metacarpophalangeal joint, I don't explain to you where this joint is because you know what is the metacarpal, what is the phalanx, because they are in this table and you are familiar with them. So you know this is the osteotomy in this joint today. And also there are three more tables that I collected the most common musculoskeletal terms. These are the combination of those roots, suffixes, and prefixes. And these terms are the most common terms that are in use in orthopedic surgery. Again, you don't need to memorize them, but become familiar with them. You will hear lots of them during our lectures, especially since I have been in contact with engineering department for several years. I am used to talking in a simple language, but during the lectures, other surgeons, which you will have during your course, you will see if you are not familiar with this term, you will not understand them. They will talk to you and you have to ask about the meaning of different words. For example, they say, we put a pedicle screw to correct the kyphosis of the spinal deformity. And if you don't know what is pedicle, what is kyphosis, you will not understand them. These are some diagnostic terms in my musculoskeletal field, and these are some procedures. You will hear these procedures. Let's review them, some of them. Arthrocentesis is aspiration of a joint. You insert a needle inside the joint and aspirate it. Arthroscopy is using a camera scope and inserting it inside the joint. So arthroid joints, scope vision. So viewing inside the joint with the camera. Arthroplasty means repairing a joint, but repairing a joint means any kind of repair. It can be a surgery to replace the cartilage, to suture the cartilage, or to insert an implant. But specifically in today, orthopedic surgery, when we say arthroplasty, we mean implantation of a prosthetic joint into a degenerated or destroyed joint. Fasciectomy means excising, removing the fascia. Fascia is the covering of the muscle. It encircles the muscle and covers the muscle. Meniscectomy. Ectomy means removing excision, like fasciectomy. And meniscus means meniscus. So meniscectomy means excision or removing of the meniscus. Myo means muscle. Myoplasty means repairing a muscle with surgery. Myography means suturing the muscle. Osteoclasis means breaking the bone to correct a deformity. For example, a bone is bent, we break it. This break in the bone is called osteotomy. And then we correct the deformity. This correction is called the whole procedure. Breaking and correction is called osteoclasis. Osteoplasty is a term, is a general term, means any repair of the bone by surgery. Osteotomy, as I said, is cutting the bone, homing cut, cuts your bone, so cutting the bone. Patelectomy, ectomy means removal, excision. Patelectomy, patella is the capbone, a kneecap bone. So patelectomy is removal of the patella or kneecap bone. Hand means, sorry, hand, not hand means tendon. Desis means fixing something to somewhere. For example, if you fix a rope by a nail to the wall, it is called desis. So tenodesis means fixing a tendon to the bone or to somewhere. Tenomyoplasty, plasty means repair. Myo means muscle, teno means tendon. So it means repairing a muscle and its tendon. Tenorrhaphy means, rhaphy means suturing, suturing something. So tenorrhaphy means suturing the tendon, and tenotomy means cutting a tendon. Tomy means cutting, like osteotomy. So tenotomy means cutting a tendon. These are some general procedures. You will hear them a lot in your course. So, by terminology, again, I don't want you to try to memorize everything. I want you to become familiar. When you hear something, you are familiar with it. And gradually during the course, when you hear them repeatedly, you will learn them, okay? Like your mother tongue. You didn't try to memorize any word when you were trying. You learned it by repeating, okay? Now, let's talk about some terms in our body. Again, these are the terms that you hear a lot, and if you are not familiar with them, it makes the communication difficult for you. First of all, when we are talking about any anatomic posture, anything in anatomy and medicine, if we do not specify anything, we are talking about an anatomical position. Anatomical position is the posture when a person is standing up, erect, the feet are slightly apart and pointing forward, palms are facing forward, and the thumbs are pointing outward laterally, as you see in the picture. So you see the hand, the feet, head, everything are in a predefined location. So when you are talking about the location of the hand relative to the head, this is a standard location. Unless we specify a specific anatomic position, for example, bending forward position, bending lateral position. But if we don't mention anything, we are talking about this position. And one important thing is when we are talking about the left and right in medicine, we are talking about the left and right of the model, of the patient, of the anything that is in front of us. The X-ray, the MRI, the CT scan. We are not talking about our left and right. Okay, so the left and right in the X-ray, in the model, in the patient is opposite to my left and right. So this is important because we don't look at the X-rays uh, with our left and right. We look at the X-rays with the patient's left and right. And it is exactly opposite to our left and right. We have some terms called directional terms, and you know all of them in your general language, but let's review them. Superior means up, inferior means down. When we say something is superior to the other thing, it means, for example, if A is superior to B, it is above, A is above B. In this picture, you see head is above chest, and chest is above leg, and legs are below the abdomen. They may be the superior and inferior doesn't mean they contact each other. It is just a relative word. The same thing is true for medial and lateral. Medial means toward the midline or toward the inside of the body. Lateral means toward the outside or toward the lateral. So the chest is medial to the arm, and the hand is lateral to the hip. We use these words too much in surgery. When we are talking about the location of things, we use this word. So you must be familiar. Medial, lateral, superior, inferior, anterior, posterior. For example, here, anterior and posterior is the same. Anterior means toward the front, posterior means toward the back. You don't say front and back in medicine. You say anterior and posterior. If something is in front, it is anterior. Something in the back, it is posterior. So try to make your ear familiar with this word. When we are talking about the extremity, only extremity, you have two terms, proximal and distal. Proximal means toward the origin of the extremity or limb. Distal means toward the end of the limb. For example, shoulder is proximal to elbow, and hand is distal to wrist. Sometimes we use these two words for some other parts of the body, like vessels. But when we are talking about the vessels, we consider the vessel as a separate entity, not as a body part. We are talking about the anatomy of that vessel or that bone, and then we can use the proximal and distal. But generally, we use these two words for only the limb, upper and lower limb. We can divide the body into two major parts. These are called regional terms. One region is the axial part, and the other one is appendicular part. The terms are clear. Axial part is the central part of the body: head, chest, abdomen, and pelvis. And whatever is attached to this axial part is called appendicular part, upper limb and lower limb. So upper and lower limbs are appendicular part. Whatever in these two in these four limbs are called appendicular anatomy, and whatever is in the central part, in head, neck, chest, and abdomen and pelvis are called axial. That was a very general classification. The whole body was classified into two parts, but we generally use other terms: head, neck, chest, abdomen, pelvis, upper limb, and lower limb. Head and neck are clear. You know the definition of head and neck. Chest is the part that is covered by the rib in the back and in the front. Abdomen is the part below the rib, and the pelvis is the part that is deep inside the pelvic bone. Then the lower limb and the upper limb. In mathematics, you have three coordination planes: XY, YZ, and XB plane. They are perpendicular to each other, and anything when you want to define the location of something in the space, you use these coordinations and you define that location. We use these three imaginary planes in the human body, and they are imaginary. There is no such a plane in the human body, but we use them. We have three perpendicular planes. The first one is called sagittal plane. These planes are very important, so please try to memorize them and learn them. Sagittal plane is a vertical plane that divides our body into two left and right parts. So it goes from front to back, anterior to posterior, and divides the body into two left and right parts. Since the human body is almost symmetrical in left and right part, almost symmetrical. If you look into the mirror and compare your left and right part of your face, you see they are not exactly symmetrical. Your left and right eye are not the same. Your left cheek and right cheek, your left ear and right ear, they are not the same, exactly the same. They are almost different. So if it has the sagittal plane through the middle of the body, we can have two almost symmetrical halves of the body. So we can divide the body into two almost symmetrical halves. This plane that passes through the middle of the body is called mid-sagittal. If it has another plane parallel to this one, but not through the midline of the body, through the middle of the body, this plane is called parasagittal. We can have unlimited number of parasagittal planes through the body. So it can pass through here, here, here. So we have unlimited number of parasagittal planes, but we only have one mid-sagittal plane. The mid-sagittal plane divides the body into two almost symmetrical right and left halves, but the parasagittal plane divides the body into two non-identical halves. Another plane is called frontal or coronal, and it divides the body into anterior and posterior. We don't have any mid-frontal because the body is not symmetrical from anterior to posterior. And also in axial or transverse plane, we don't have any mid-transverse. The transverse plane or axial plane is a horizontal plane that divides the body into superior and inferior parts. Again, for frontal transfer, like parasagittal planes, we have unlimited number of planes. These planes can pass through any point in our body, but they must be transferred. So it can pass through the head, through the ear, through the neck, any place you want, and you can define the anatomy along this plane. These planes are used in surgery. During the surgery, sometimes we use this term based on the cut we are doing. For example, we say cut is in the sagittal plane. So the surgeon knows the cut must go from anterior to posterior, or cut it in the frontal plane. Surgeon knows cuts must go from one side to the other. Or transversely cut the, for example, transversely cut the bone, it means cut the bone along the transverse plane, and then you determine the location, for example, 3 centimeters below the joint. Another use of these terms are in imaging. In discussion of imaging, I will explain it for you. You have seen, I'm sure you have seen some CT scans. The CT scans are specific imaging technique that cuts the body along the transverse plane. And whatever you see in CT scan are several successive transverse cuts of the body along the axial plane. And you must be familiar with the anatomy. If you want to study CT scan, you must be familiar with the anatomy of the body along the axial or transverse plane. In anatomy and surgery, we have these 3 main planes: sagittal, frontal, and transverse, so axial. But since the new imaging technology allows us to capture the images along any plane that we like, we have oblique planes that are not predetermined. You can determine the angle of the capture of the image, so the gantry of the CT scan or MRI can tilt and get the exact image you want along that specific oblique plane. So today, we have lots of oblique planes based on the anatomy. For example, if you later we will discuss the anatomy of the knee anatomy. In knee, we have 2 cruciate ligaments called anterior cruciate ligament or ACL and posterior cruciate ligament or PCL. You may be familiar with the ACL because it is commonly injured in people who are active in sport. Their location, location in the knee are in an oblique orientation. They are like when you look at them from the anterior, they are like an X, but when you look at them from the superior, they are still like an X. So if you have the X-ray or MRI along these perpendicular plane, you don't have the full length of ACL and PCL in your MRI. You have the cuts at different parts. But if you tilt the gantry to fit the orientation oblique orientation of these ligaments, you can have a card, an image along the full length. And this is why you use the oblique planes to get the case imaging view for different anatomical parts. To do that, we need to know the anatomy perfectly, and that's why anybody who wants to work on this field needs to have a basic anatomy knowledge, because if you want to design a device that can capture the injuries of different parts of the body, different bones, different ligaments, you need to know the anatomy to be able to design something that can capture it in the best position. And the last part. Do you have any question? Oh, one important thing I forgot to tell you. I have a rule in my classes. If you have any question while I am talking to you, please stop me and ask your question, okay? You can stop me anytime you want and ask your question, because if you don't ask your question, you may forget it, and later you will not ask it. Okay? Don't worry. I won't be angry if you stop me. Again, about the motions, we have different types of motions. I don't want to confuse you with different definitions. I want just to make you familiar with some terms, okay? So when you hear a surgeon says the knee flexion, I want you to know what it means, okay? We have angular motion, we have rotational motion, and we have specific motion. Angular motion, the name shows, there is a change in the angle between the bones that are forming a joint. For example, when we are talking about the motion in my thumb, there is a bone here and there is a bone here. So there is a joint between them. When the angle between these two bones changes, it is called the angular motion. It is called an angular motion. Or for my wrist, I am performing an angular motion. Now remember the anatomic position. The joints were straight. Every joint was straight, and the thumbs were pointing outward. When we change the angle between the bones and the angle between those two bones decreases, it is called flexion. For example, for shoulder flexion, this is the anatomical position. The shoulder flexion means moving the shoulder forward. Or for elbow, it means decreasing the angle between the forearm and arm bones, like this. Or for knee, as you see, means bending the knee. This is the anatomical position, and this is bending the knee. I don't know if you see my here you see this is the anatomical position, and this is bending the knee in this direction. Or the middle one in the head is the anatomic position. Decreasing the angle means flexion, bending forward. Returning from flexion to the anatomical position is called extension. So if I have flexed my elbow and I return it to the anatomic position, it is called extension. Or for shoulder, you see from flexion to anatomic position. For knee, from flexion to anatomic position. Or for head, from here, anterior bending to anatomic position. If we have the anatomic position in the reverse direction, it is called hyperextension. So hyperextension means passing the anatomic position in the reverse direction of the flexion. For example, for knee, it means bringing the foot forward a little bit and hyperextending the knee. For shoulder, it means moving the arm backward towards the back. And for head, means bending backward. We have another angular motion. It is called abduction and adduction. It is an angular motion in the frontal plane. I forgot to say, flexion, extension, and hyperextension are performed in sagittal plane. And you see the sagittal plane in our body, in that case, and all the flexion, extension are in along the sagittal plane in my body. But if you perform a motion, angular motion along the frontal plane, the plane that cuts your body into anterior and posterior division, if you perform a motion along the frontal plane, it is called abduction and adduction. Abduction is moving the body and moving the body part away from the body, and adduction is returning it to the original position toward the body. So if you move your arm along the frontal plane outward, it is called abduction, and when you bring it back beside the body, it is called adduction. You can do this for the lower limb, abduction, moving away, adduction, bringing back. For trunk and head, since we cannot move it from the midline, like the limb, we call it lateral bending. Left lateral bending, left lateral bending, and right lateral bending. Left lateral bending for head and right lateral. If we combine a flexion, abduction, a hyperextension, and adduction, and continuously and successively, it is called circumduction. Actually, with circumduction, you are rotating your limb in the space, and this motion can happen only in shoulder, hip, and base of your thigh. Only three joints can perform this motion: base of thigh, shoulder, and hip. We have a rotational motion which happens along the axis of the body, of the limb. For example, I am rotating my upper limb. This motion happens in shoulder, in upper limb, in shoulder, in lower limb, it happens in the hip, and in head and neck, happens in the neck. So later, we have another motion that is different from internal and external rotation, and this you must know it. Internal and external rotation in upper limb happens in shoulder. When I am rotating my limb, I am rotating the whole arm and forearm together. Okay? This is external and internal rotation. External and internal. External and internal. In the head, since we don't have internal and external, we call it right lateral and left lateral, but it is the same motion. Now, some specific motions. These motions are specific because they happen only in one joint and they have a specific name. First, pronation and supination. I told that internal and external rotation happens in shoulder, and the whole arm and forearm are rotating. But if you keep your arm attached to your body and flex your elbow and hold your palm up, now if you rotate your hand and turn the palm down, as you see in the picture, this motion that turns your palm down is called pronation. And when you return it and turn your palm up, it is called supination. When you perform this motion, your arm is not moving, your shoulder is not moving. Everything is happening in the forearm and the elbow. That is why it is different from external and internal rotation of the upper limb. It only happens in forearm and in the elbow. And as you see, my arm is fixed to my body and I can rotate my hand up and down. This is called supination and pronation. In ankle, we have flexion and extension, but the name is a specific word. The dorsiflexion means moving the foot toward the leg, and in plantar flexion means moving the foot toward away from the leg and toward like pushing the brake in the car. So these are the same flexion and extension in the sagittal plane, but they have a specific name. In the foot, we have specific motion called inversion and eversion. Inversion, as you see in the picture, the sole of the foot is turned inward. And if we turn the sole of the foot and the whole foot outward, it is called eversion. So in ankle, we have a flexion and extension in sagittal plane, which we call them dorsiflexion and plantar flexion. And we have an eversion, turning the sole outward, and an inversion, turning the sole inward. And the most important motion of the human being. You are a human being because of two things. You are different from other creatures because of two things. The first one is clear. It is your brain. Correct? But the second one is your tongue. The tongue makes you different from any other creature in the world. And the motion that the tongue can perform for you makes you a human being. If somebody loses the tongue, the whole function of the hand will be lost. It can only function as a paw, for like the paw of a cat or a dog. You see, they cannot do anything with their paw. They cannot hold anything. So tongue is everything in our hand. And the most important motion in tongue is something called opposition. When you want to hold something in your hand, actually you are performing opposition. Opposition means opposing your thumb with your other finger. And this is the motion with which you can hold everything in your hand. Opposition is a motion, but it is a combination of several motions: flexion, internal rotation, abduction of the thumb, and flexion of the other finger, as you see. And when we return the thumb to its original position, it is called reposition. So opposition, reposition. And as I said, this is the only motion that we have and other creatures that do not. All the other motions we discussed are present in other creatures, except this opposition. Opposition is unique to human beings. Okay, I think it's done. Any question? No. Okay. Next session on Thursday, we will discuss a little bit about every week I will upload the slides for the whole week on Canvas, so you can have access to all the slides. Let me finish this. So you can have access to the slides for the whole week in advance. I try to upload it Saturday or Sunday every week. In my classes, everything you need are in your slides, okay? But as I told you, I have prepared 2 books for you as your references for the whole course. One is a book about the medicine, about the anatomy, physiology, and everything you need to know. It covers the whole human body, but you just need to know about the musculoskeletal system. And the other book is about the rest of the program. They are under publication, so they are not ready to handle to you, but I have the files. I cannot give you the whole file because they are the property of the Springer, and I cannot give you the whole file, but I give you chapter by chapter as you need, okay? And please don't share them with anybody because they will kill you. So, as we move forward, I will share not only the slide, the chapter of the book that is prepared and will read the study. That's it. And tomorrow, we will have the clinical immersion discussion. The Precision OS platform is not available yet because of the paperwork in the university. You are familiar with the things in the university. It takes time, but we don't need it yet. For the first 2 or 3 sessions, we don't need it. We will discuss external fixation surgery, and we will see how it works, what it is, how we perform it. We will watch some videos together, and then you can watch the video again to see how it is. If you have any questions, you can ask me. Again, this is the first session. You may not be familiar with my name, so again, if you have any questions, please ask me. I told you before, if you think I have not included any discussion in the program and we want it to be discussed, please let me know. You can add it to the discussion. If you think about something in your future career, for example, you want to specialize in ACL reconstruction, and the ACL reconstruction we discussed here is not enough for you. You want to know more about it. We can prepare it for you. I'm here for you, okay? I'm here for you, so let's make most of it from our presence here and try to learn as much as we can, okay? So don't worry, if you ask me to add something, if you ask me about an extra session, I have free time to do that, okay? Don't worry. I just want you to be an expert in orthopedic engineering when you graduate. So I want to try my best to do that. Okay? If you don't have any question, see you tomorrow. Otherwise, ask me. No? Have a good day. Bye.
Thank you, Dr. Hamid.
Thank you.
Thank you, Professor.
Nicola, don't leave. I have a question. How was your class, the elective class? Was it today?
It starts tomorrow, but I had a question about that.
Okay.
We're not in the on Canvas, we're not in that class yet. Like they haven't put us in the Canvas class yet.
Call the professor and see what I can do. Okay?
Okay.
Okay. Good night.
Thank you very much.
Thank you.
Professor, I just wanted to say again that I'm not going to be in the classes this Thursday. I'm going to miss the two classes on Thursday because I have to travel for my football game. I'm sorry, I can't hear you.
You know me, no problem.
Okay. I think this is going to be the only time this is going to be like a conflict of schedule. After that, I should be fine. So,
No problem. The point is you learn the class.
yeah.
Okay?
Mhm.
I capture the video and I will share it with you. You can watch it. If you have any question, you can ask later. But the point is you learn. That's it. Enjoy your day.
Thank you very much, Professor. You have yourself a good day.
You too. Bye.
Goodbye.